You swam in it. You fished in it. Maybe you just walked through it after the rain. And 3 days later you have a splitting headache. Your muscles are on fire. And your skin has turned yellow. This is not the flu. This is Weil's disease. And it can shut down your kidneys, your liver, and your heart within days. Stay with me, because knowing this could save your life or someone you love. Weil's disease is the most dangerous form of a bacterial infection called Leptospirosis. The bacteria responsible is called Leptospira, and it lives inside animals you encounter every single day. Rats, cattle, pigs, dogs. When those animals urinate, that bacteria gets into soil, rivers, floodwater, and even puddles on the street. You do not have to drink the water. You just have to come into contact with it through a cut, your eyes, your nose, or your mouth. Most people who get leptospirosis recover on their own with some flu-like symptoms. But in a smaller number of cases, the bacteria gets into the organs, the liver, the kidneys, the lungs, the heart, and the brain. That is when it becomes Weil's disease, and that is when it gets life-threatening. Symptoms usually show up 5 to 14 days after exposure. It starts like any other illness: fever, chills, nausea, vomiting, loss of appetite, muscle pain, headache, and cough. 1 to 3 days after the initial symptoms fade, Weil's disease can take hold. You may notice jaundice, yellowing of the skin and eyes, swollen ankles, difficulty breathing, or symptoms like meningitis if it reaches the brain. The Leptospira bacteria spreads through the urine or blood of infected animals, most commonly rats. This is why the disease spikes after floods. Risk factors are highest for farmers, veterinarians, sewer workers, and freshwater swimmers. If your doctor suspects Weil's disease, they will perform blood and urine tests. Treatment involves hospitalization and intravenous antibiotics like penicillin or doxycycline. Prevention is key. Wear waterproof gear, practice rodent control, and wash your hands thoroughly after being outdoors or handling animals. Weil's disease is rare, but dangerous. Now you know what to watch for. Share this with anyone who works outdoors. Stay informed. Stay protected.